I'm Ivelisse Page, and thanks for listening to the Believe Big podcast, the show where we take a deep dive into your healing with health experts, integrative practitioners, biblical faith leaders, and cancer thrivers from around the globe. Welcome to today's episode on the Believe Big podcast. My name is Ivelisse Page, and I'm excited to spend this time with you. My guest today is my new friend, Jacob Williams. I had the pleasure of meeting Jacob at a recent integrative cancer conference. Jacob is an award-winning commercial filmmaker, producer, and director with over 25 years of experiencing creating impactful visual stories for major brands like American Express, AT&T, Volkswagen. Known as a people director, he built his career capturing authentic, real-life moments that resonate deeply with audiences. Jacob is also a prostate cancer thriver, and that experience profoundly reshaped his work and purpose. After navigating the overwhelming gaps between conventional and integrative care, he now uses his platform and his company, JCW Studios, to document patient journeys and highlight physicians advancing integrative medicine, helping to bring clarity, understanding, and hope to others walking a similar path. Well, I'm so excited to have you. Welcome, Jacob, to the show.
Thank you. Thank you very much for that introduction. Wow.
Well, we are so grateful you're here. And, everyone always loves to hear our guest's favorite health tip. And so do you have one that you can share with us?
My favorite health tip that I just kind of refined because I've always been active, but I think one of the secret weapons to, living a healthy life and longevity and fighting disease is really exercise. That is as quiet as it's kept. It's very important. And exercise, know it or not, it's not just about how well you play or how, what you look like, how your clothes fit. It really is about how much you are helping your immune system. You really help your immune system when you are exercising and strength training. It definitely helps. Muscle secretes myokines, which really boost your immune system and help you to fight disease. And I'm not just talking cancer. I'm talking from colds to chronic disease.
Yes.
It really does help.
Yes. Yeah. That's a great tip. And, it's very important. So many of us have seen the value of it, and not only on cancer journeys, and that may look differently for people on a cancer journey and post and even before. But yes, it is so important to exercise in some capacity to keep our bodies healthy and strong. So Jacob, can you take us back to the moment of your diagnosis? What was going through your mind, both as a man and as a storyteller?
Well, for a number of years prior to being diagnosed, I was getting signs. My PSA was going up. And all guys know, you go to the doctor, you get this PSA test. It's a blood test. And when you hit a particular number, your general practitioner, his eyebrows go up. You got to go see a urologist. And they send you off to a specialist. So I started out, I had a 4 in my blood test, and they sent me off to a urologist. And the urologist was like, we're going to keep an eye on it. We're going to watch it. And so my PSA continually rised. It went from a 4 to a 5 to a 7. And then they start doing more testing. So we went from a blood test. Now we're going to do an MRI. Now we're going to do a PET scan. Now we're going to do a biopsy. So before I got diagnosed, I wound up with like 4 biopsies. Very uncomfortable, not fun. I don't recommend it to anybody. For each biopsy, they probably take somewhere between 12 and 20 samples of an organ. And, your prostate is only like the size of a walnut. who, you go in, people, you get 4 biopsies, like 80 pieces taken out of your prostate. Do I have a prostate left? So you go through that and then you get diagnosed. And the moment you get diagnosed, or the moment I was diagnosed, the doctor handed me 2 pamphlets. And it was either radiation or surgery. Take these 2 pamphlets, read them, decide what you want to do. Now, I had just moved to Atlanta. I'm divorced, by myself. I had a few friends here, but basically by myself. And the reason why I moved here, because I was getting work here, and it was like, why not go to where you're getting the work? So I came to Atlanta, started working, got really busy, and I was like, your PSA has been going up. You need to create your health network. Go get a doctor, go get a general practitioner, get a urologist, go follow through on all this. So I get here, go through the same steps again. General practitioner sends me off to a urologist. The urologist has me do a blood test, and then an MRI and a PET scan and a biopsy. And then he says, hey, man, your PSA is at a 13. You have 3 lesions in your prostate. You have a Gleason score of a 6, 6, and a 7. The 7 denotes that it is aggressive and we should do something about it. Here's 2 pamphlets. You decide what you want to do. So in that meeting, in that doctor visit, just to hear the word cancer kind of blows you out of the water. But I should have been prepared, having biopsy after biopsy after biopsy, but still, I wasn't. You hear that word and, the wind has been taken out of your sail. You can't breathe. You can't talk. And I finally, I guess I pulled myself together and was able to ask the doctor, so what happens if you take out my prostate or you radiate? And he was like, oh, you just don't make semen anymore. That didn't sound right to me. It sounded a little unusual. So I did some research and I began to ask a lot of questions. I began to ask questions of my friends, family. Hey, is anybody else in the family that prostate cancer? No? Okay, so it's not genetic. And I am asking my friends, and I'm in shock that some of my friends are like, oh yeah, man, I took care of that 10 years ago. I go, what do you mean you took care of that? What does that mean? I took care of it. Did you go to the body shop or something? I mean, like, what happened?
Yeah. So, you just said something important that I think that a lot of people, especially men, they struggle to talk about their health. They struggle to talk about cancer. Why do you think so many men struggle, not just to talk about prostate cancer, but even to seek clarity about their health and options?
I really believe it is a societal factor. Men have been taught not to talk about those things. And the conversation needs to be normalized. And that's why I try to talk about it on my platforms as openly as possible. And also, society helps men with this. When you hear people talk about prostate cancer, nobody gives you any details. Oh, I had that. I got it taken care of. You should go get screened and save your life. That's it. Like, are there any pitfalls? Is there a difference between stage 1, stage 2, stage 3, stage 4? Are there stages? What does it mean if you're a stage 4? What does it mean if you're a stage 1? Why is that not talked about? So I think the conversation has to be normalized in order for men to begin to react. And I also think the conversation needs to span the entire health of your prostate, from healthy to fully diseased.
Yeah. Do you think that men avoid talking about prostate cancer also because of fear, or they're feeling like it'll be less on their identity, or just simply not knowing how to start the conversation?
Well, I think it's attached to manhood, and manhood has a lot to do with your body functions.
Hmm.
So if you're not able to, have erect penis, then you've got a problem there, and you don't want to talk about that. That makes you less of a man. And men don't want to have to be in that boat. But all that can get fixed.
What have you learned from other patients and physicians working in the integrative medicine world that you wish you had known earlier?
Oh, what I wish I had known earlier that simply there are other ways. I do not condemn conventional medicine. Conventional medicine just has a stronger marketing tool. It's been living a lot longer than any other medicine. And I'm not talking about conventional medicine itself. I'm talking about its marketing arm. Its marketing arm has been stronger than any other health marketing arm out there. And so, therefore, that's what we hear. That's what we believe because we hear it the most. And I think conventional medicine is so necessary. We need it. There are so many tools conventional medicine has that can help us heal. But there are other things out there that can help us heal as well. To begin with, just your body is set up to work to heal, but you have to be giving it all the right tools. You have to be, so that means, what are you putting in your mouth? What are you putting on your skin? What are you putting on top of your head, your hair, but all that, what are you breathing in? So, I just believe people are just not aware.
Yes, and I completely agree with you. Conventional medicine has its place. It's just really finding the right integrative oncologist or a conventional oncologist that will be a part of your team and not just saying it's my way or the highway. And there are so many that are set in their ways, but there are those who are willing to work with you in a more integrative approach. It's just really interviewing them and finding them, letting people know that you have options, right? You don't have to stick with the first person that you make an appointment with just because that's who you were set up with. You have the ability to speak with different physicians from different hospitals to find out who's going to be the best teammate because listen, that person is going to be following you for years to come. It's not just a one and done time. So yes, it's really important that, you have someone that's alongside of you, but also in the same token, like you're mentioning, having the integrative approaches that are going to be sprinkled in at the right time, in the best places to really give you the best quality of life and quantity of life. And that's where the beauty of integrative medicine comes in. You don't need to suffer going through traditional treatments. I see that all the time. And just something as simple as mistletoe therapy, I've seen night and day change a person's even color of their skin, to their mood, to their strength. So much can be done that people aren't aware of and that conventional doctors are not able to even share about. They're only able to share, as you talked about, surgery, radiation, and chemotherapy. Those are their three options. Their three tools, the three hammers.
Yeah, absolutely. Number one, I never went back to that urologist who diagnosed me. He gave me 2 pamphlets. I went home and that was the end of him. I was done. My sister is an OBGYN. And of course, I called her right away and she said to me, you gotta listen to your doctor. And I laid it out to her. I was like, I don't trust that doctor. I don't believe what he said. I did a little research and he's not telling me the full truth. There's some stuff that's being omitted. So, I could wind up in a diaper, incontinence. I could have erectile dysfunction. I don't want any of those things. So I asked my sister to help me find other doctors, and I went on this second opinion role. I probably got about 4 of them. So I did that. But what I did learn is that there's another way to do it. And because I began to ask a lot of questions to as many practitioners and friends as I could, I began to learn that number one, the conventional doctors are pretty much going to take you down a trained path, and I wanted to hear something different. And I got exposed to something different, and I really, really walked towards it just in order to learn. And as I heard different things and began to try them, I really had to believe in I had to believe in my faith to say nothing's going to happen to me bad while I try these things out. Because when you get a cancer diagnosis, one of the alarm signals is to get this thing out of your body right away and at any means necessary. So you kind of have to dampen that for a minute. And you really have to do the research and begin to investigate other things. And you have to figure out, like, do those things really quantify you saying, I should believe in it?
Yes, I really think like what you're saying is really weighing the risks versus the benefits of every option that is presented before you so that you can wisely and prayerfully consider what is going to be the best path for you. You know, that your care is individualized and not standardized by their eyes. And so what did you do? What did you end up deciding to do? Because you're here today, healthy, strong, helping so many other people. And I know people will be curious to know what you ended up deciding to do conventionally and also on the integrative complementary side.
Well, the first thing that happened to me after being diagnosed is I was introduced to a functional medicine doctor and a homeopath, and they put me on a raw diet. First go into a fast, then go into a raw diet, and with explanation. You know, what's happening to your body is happening on the inside, and it's because you're feeding it. Whatever you put in, and you're eating all this processed food, stop that. Just stop eating everything for a minute. And then when you, to break your fast, then we're going to start with water and just raw vegetables, go on a raw diet. So I did the raw diet for 3.5 months. And then I went to just eating cooked vegetables. And I probably did that for about 2 years. And it took me a while to heal. Healing takes a while. Doesn't happen right away. You know, you hear a lot of stories about somebody had, loss of tumors in 3 months. And I'm like, that is fantastic. That didn't happen to me. When I began to lose the tumors, they went away quickly. But the preparing your body to begin to help you wipe these tumors out takes a while. So I had to reset my body, basically. As I look back on it, I reset my body. I went into a raw diet. I began to just eat vegetables only. And I was introduced to mistletoe. I did subcutaneous mistletoe probably for 8 months. And so the chronological order to that was functional medicine doctor, homeopath, put me on a raw diet. After the raw diet, I was told to go get a mistletoe shot by the homeopath. Now, I had no idea what that was. I was told to go see this guy, Dr. Mark Hancock, and go get a mistletoe shot. So, going to see any doctor, that is 2 months before you get in. So, you go make the appointment, you finally get the intake, you sit down with him, and he says to me, you're here early. Most people come to me as a Hail Mary. You haven't done anything yet. And I said, I'm trying to keep all my body parts. I like to keep everything intact. I want to be whole. I'm getting old, so I want to be intact as I age. And he was like, okay, well, he put me on this program of subcutaneous mistletoe. I did that for about 8 months, and he kept talking to me about hyperthermia, but he didn't have the hyperthermia equipment to put me into. He said, I need to get to your prostate. If I can get to your prostate with heat, directly to your prostate that would work. We were talking about a clinic in Germany. I don't even know how I was beginning to, think about that. But as I started doing the research, he gave me a number of clinics to look into. As I started doing that research, he found a guy who had manufactured a local hyperthermia machine, Dennis Clark, Thermofield. He said, you could be the first to use it. I went to his office and I did roughly 2 months of mistletoe infusions along with hyperthermia. So basically, I would sit on a small pad that would project heat through microwaves 6 centimeters deep into my body. So I would literally just sit on this thing and heat my prostate right after I had a mistletoe infusion. I did that for about 2 months and went and got a MRI and lost 1 lesion.
Amazing.
I was like, okay, right on. This is it. But again, prior to that, I did 8 months of subcutaneous and went after the 8 months, went and got a MRI exam and a PET scan, and everything was exactly the same way it was when I was diagnosed. So immediately I was disappointed, but I had to look back. I had to look back at the history of my disease to see that there had been steady progression up until I started taking this mistletoe for 8 months. And so basically the disease had stabilized. So I really had to go home and sit with myself and say, it's stabilized. It's not growing. It's stabilized. It's not growing. Because I was freaking out. I was like, didn't work.
Yeah, I think that, that's a very important thing that you shared, is that it had been progressing and progressing and progressing. And it was the first time that it had stabilized. It didn't continue to grow. And so your body at that point was resetting with the raw diet that you were doing, with the mistletoe therapy, and then just adding that extra layer of the IVs and the hyperthermia, which, by the way, hyperthermia chambers end up heating your body to a higher core temperature that helps to fight off viral loads and infections and, cancerous things. And so that's why, that aspect was so important. So Jacob, yeah, it's incredible. So how long before you started your treatment to you becoming no evidence of disease?
I would say 8 months, and then it was probably 2 years.
Amazing.
So
Amazing.
let me tell you, this is the quirky thing. I met Dennis Clark because I had some success with hyperthermia and his particular unit, Thermofield, and we had conversations, and I wound up doing a sales film for him. So I went around and I interviewed a couple of doctors that were having success with women's breast cancer. They were using compounds, whether it was mistletoe or IPT or Chinese wormwood, but they were injecting the breast directly, the tumors directly in the breast with these different compounds and then heating the breast. So I interviewed a number of doctors, and I interviewed Dr. Hancock, who was also treating me, and he said the exact same thing. And when I was done with the interview, I was like, dude, you're injecting women's breasts? Can you inject my prostate? And he was like, whoa. He said, and the reason why he said, whoa, I don't know. He said, number one, that has to be guided. That area is sensitive, don't know how to actually get to it. He said, but I'll find somebody who's injecting prostates. I think I know a guy. And, another 2 months, and he comes back, he goes, I got a guy for New York, Dr. Hal Blattman. Dr. Blattman had been injecting men's prostates with ozone in order to reduce the BPH. Men's prostates usually swell as they get older, and it's caused by inflammation and bad diet and many other things. And he was shrinking prostates, and that's what causes men to have issues with urinating frequently at night, that sort of thing. So I got in touch with Dr. Blattman, and I went to him I probably got 5 injections over a 6-month period. of mistletoe and ozone directly into my prostate. And after the second injection, I had an MRI and a PET scan, and I had lost a second lesion. So I kept going.
That's
But
amazing.
I think overall, the whole thing is cumulative. I think if I hadn't cleaned my body out, my body would not have been receptive to, the other treatments that I was getting. So I had to clean my body. I had to, set my mind, all that jazz.
Yeah, that's why cancer is one of those complicated diseases, because there are many buckets that overload our body, and there are so many facets, and you just mentioned it, not just on the physical side of healing, which a lot of people just tend to focus in, but there have been so many studies done on how your emotional and your spiritual state also affect your physical state. If you're stressed, your cortisol levels rise, your insulin levels rise, which causes inflammation in your body. It creates a perfect storm for cancer to thrive. And so our emotional healing tools that we have at Believe Big, our spiritual healing tools, are so vital to this holistic approach of facing, fighting, and overcoming cancer. And in the last few minutes of this podcast, I would love for you to share, looking back, how has surviving prostate cancer changed your definition of strength and vulnerability? And what do you want other men to understand about that?
Well, I want other men to know that it's really important to talk. It's really important to talk about it. It's really important to ask questions. And you have to do research so you can make informed decisions. But it's so important to open up and talk to everybody in your circle.
I love that.
You also have to develop a circle. You have to develop a circle of people that you trust, and recognize that being vulnerable is actually a strength. When you open up and talk about stuff, that's pretty strong stuff to do.
Yes.
When you tell people, I'm afraid, I'm not sure, I don't know, it's okay. It's absolutely fine to do that, because when you do that, that's when you learn more. That's when you become calm. That's when you are no longer, it's not necessary to be afraid. People are going to come to you with information.
How can families and loved ones support men in opening up without making them feel exposed or pressure?
I don't know. That's a tough one, because I feel like my entire family was very open. I became fanatical about food, about my health, about exercise, about, what doctor I was going to see. And they all went along for the ride. And they supported me by sharing information as well as eating the way I ate. They began to adapt to things I did. Do not get me wrong, there was resistance at first, but as my son would say, I have 4 kids. My middle son, he said, I forgot that you had cancer. You started looking healthy. Each time I saw you, you showed up. You looked good. You looked strong. You're eating funny, but, everybody else started eating funny right along with you. He said, I forgot you had cancer. So it was kind of a, okay. When you said, hey, no evidence of disease, I was like, yeah. What did we expect? Look at you.
I love that. I love that. And to close this podcast out, what would be one bit of encouragement you can give to that person who's listening today, who has cancer, not necessarily just prostate cancer? What is one bit of encouragement that you could offer them?
You have to be positive. And why I say positive, as soon as you learn as much as you can about your disease, about your situation, that is the thing that should give you enough positivity to try and figure out what's the best way for you. And you have to do the things that you're willing to do.
Yes. Well, thank you, Jacob. We will put in the show notes your website, Jacob Beat Cancer, for anyone who wants to get connected with you and to find out more. We'll also put our Believe Big resource as far as questions to ask oncologists and even an informational page to give to oncologists about mistletoe therapy. I think the more information we have, the better we can in advocating for ourselves and for others along this journey. But thank you so much for joining us. It's been a pleasure to speak with you today.
Likewise, Ivelisse, thank you.
If you enjoyed this episode and you'd like to help support our podcast, please subscribe and share it with others. Be sure to visit believebig.org to access the show notes and discover our bonus content. Thanks again, and keep believing big.